Welcome, everyone, to the People's Health Briefing, a key component of our Trusted Voices campaign. I'm Dr. Noha Balada from Roots Community Health, reporting for the week of March 17th, 2025. As health professionals rooted in Oakland, serving some of the most marginalized communities in California, we're here to cut through the noise and bring you the latest information on health issues relevant to us all. In today's briefing, following an update on respiratory illnesses, measles, and H5N1, I will review a recent study on long COVID and children. Starting off, taking a look at respiratory viruses, and this is the percent positive of each of these different viruses based on tests performed in a clinical setting. Influenza in the bright blue line is coming down nicely, and we expect it to continue to do so. And as flu's share of cases comes down, the share of others comes up, including rhinovirus enterovirus, so the cold viruses in the gray, and human metapneumovirus in the black, among others. And now taking a look at hospitalizations from the main three respiratory viruses causing severe illness, flu, COVID, and RSV. And this whole graph is looking at November 9th to March 8th. So really a good bit of what we refer to as respiratory virus season. We can see that flu in the blue line there had kind of a double peak, which is not unusual. One in early January and one in early February. Hopefully there'll be no more peaking after this. It does look like it is heading nicely down. And interestingly enough, it looks like COVID, which is in the orange, and RSV in the purple, also caused peaks in hospitalization in early January, really right at the same time. And since then, COVID and RSV have just been trending very slowly down. So we do anticipate that flu and RSV will come down to a very negligible level. So most likely flu will come down and cross over and drop below the COVID line, and COVID will continue to cruise along. But this is just something that we'll be interested in keeping an eye on. So far this flu season, we've seen about 41 million flu illnesses, 540,000 flu hospitalizations, and 23,000 flu deaths, including 134 pediatric deaths. And this slide is showing deaths from the three respiratory illnesses, so influenza in the blue. So looking out towards the right, we can see that we're looking through March 1st with the last couple of weeks shaded in gray, so those are still preliminary. But nonetheless, we can see that for 5 weeks in a row there, the blue line is bigger than the orange line, meaning that we've had more flu deaths than COVID deaths in those 5 weeks. And this is the first 5 weeks since the onset of the COVID pandemic in 2020, since we've seen flu deaths exceed COVID deaths. And just to keep in perspective, we are talking about 5 weeks out of 52 weeks in the year. So just wanting to keep that in mind, and we'll just have to see how things progress. But of course, this is due to the fact that flu deaths have been increasing at the same time that COVID deaths have been decreasing. So the first week that flu deaths exceeded COVID deaths was the week ending January 25th. And if we take a look here at COVID deaths, we can see that we seem to have reached the winter peak for COVID deaths the week ending January 11th, and then they have been thankfully heading down since then. Unfortunately, the week ending February 15th, there were still at least 673 deaths, so this is still a lot of people dying every week from COVID. But I think the bottom line here is that both COVID and flu continue to be significant causes of death in our population, and a significant portion of these deaths can be prevented by staying up to date with vaccination, as well as timely testing and treatment. And I will note that timely testing and treatment become even more critical for those who are not up to date on their vaccination. So if you or a loved one is not up to date on your vaccination, then you've got to be pretty vigilant about detecting symptoms early on, particularly for those at a high risk of a bad outcome. But ideally, we're doing all of the above, staying up to date on vaccination, timely testing, timely treatment. And I just want to remind us that our little ones in particular can actually be susceptible to a bad outcome even without any underlying conditions. And this is true for both COVID and flu. So I think this might be a good time to say that if you or a loved one are sick enough to go get care, either at the doctor's office or urgent care, emergency room, and you have these respiratory symptoms, I would not be leaving without getting tested. And the main two things we're especially interested in are COVID and flu. Also RSV and anything else that they're willing to test for. But why I say COVID and flu is because, one, these are causing the greatest burden of hospitalization and death, but also because we have antivirals that, if given promptly, can really reduce the risk of progression. So this could prevent hospitalization, this could prevent ICU stay, this could prevent death. So unfortunately, this might still require some advocacy depending on where you go, but pretty much any place you go for care is capable of generating or collecting a specimen with a swab for these respiratory illnesses. So I think it's worth checking, it's worth advocating for. And of course, knowing what you have is just a good idea for your own knowledge, but also so that you can keep yourself from spreading what you've got to others. Now, taking a look at COVID in the wastewater, we can see that it's still mostly heading down, except for that yellow line, which represents the Midwest. So several states in the Midwest are coming in high, and Oklahoma is very high. If you're interested in looking at the wastewater map, I have linked it in the post. Now for a measles update. As of this past Thursday, March 13th, there are a total of 301 confirmed measles cases in the United States. There are additional probable cases, but here we are only talking about those that are confirmed. So the vast majority of these cases are from the West Texas outbreak, which has led to cases both in Texas and in the neighboring area of New Mexico. And if we look at those respective state public health department websites, we can see that there have been 294 cases thus far from that outbreak alone. So that number, 294, might include some more recently reported cases that have not been updated on the CDC website yet. So just for that caveat, but back to the CDC website, there have been cases reported in 15 different jurisdictions. Most of those were measles cases that were imported from elsewhere. The only place that we do seem to have that sustained local transmission is in the West Texas outbreak. And we know that that particular outbreak, especially the cases within the state of Texas, has disproportionately affected children and is by and large occurring in unvaccinated individuals, as we would expect. So far in 2025, 76% of cases have occurred in children up to age 19. So that's represented by those first two bars put together. And it is very worrisome that 103 cases, or 34%, are in children under 5. These are our vulnerable little people that unfortunately have been left exposed and left to suffer with this. There have been 2 deaths so far, one confirmed in a child, another in an adult. It seems that one may still be under investigation. Now, not only can measles lead to respiratory failure, brain inflammation, brain damage, death, it can also wipe out parts of your immune system, so you then become susceptible to more infections even after you recover from the measles. So this is not something we want to take chances with, especially not with our children. So I really hope that folks are taking notice. If you or your loved ones have questions or concerns about the MMR vaccine, please feel free to send us a message at admin@rootscommunityhealth.org. We all deserve to have our questions answered. You deserve quality information to make your decisions. And unfortunately, there's a lot of incorrect information swirling around out there. And so with something this serious, please take the time to inform yourself. Definitely if you have folks in your life who are not vaccinated or folks you're concerned about, feel free to refer them to watch the briefing and have them to send their questions and concerns to us. We'll be happy to answer them. And now for a brief update on H5N1. So we know that right now the main risk to humans is going to be individuals who are working with cattle or poultry. So far in the United States, there have been 70 human cases. Out of those, 3 are from an unknown source, but the remaining 67 came from an infected animal. There's been 1 death so far. We've heard sort of scattered reports here and there of a few hospitalizations. The majority of cases seem to have had a pretty uneventful course and have since recovered. So right now, while we're in flu season, there's a lot of flu testing going on, and the CDC is reporting that over 160,000 specimens would have detected H5N1, or really any novel flu A as well. But out of those 160,000 specimens, 6 cases were detected, and that's again through the National Flu Surveillance System. So that's a decent amount of testing and typing going on. It remains to be seen what is going to happen when we get out of flu season, where fewer people are obviously being tested for flu. So we'll want to know more about what the plans are in that regard. But there have also been some more targeted surveillance efforts that are really surrounding animal outbreaks, and that has yielded the majority of the positive cases. So if you want to know more about the details on all of this, I have linked the H5N1 situation update page in the post. I think right now there are just a few things to note. So one is that the biggest concern I think right now is that with all of this transmission happening from birds to mammals and mammals to birds and mammals to mammals, that is a lot of opportunities for mutations, including mutations that could help H5N1 spread from human to human. And that is, of course, what we do not want to see happen. So naturally, one of the biggest concerns here is how prepared would we be if that were to take place? Because it's one thing to say a virus has pandemic potential, but it's quite another to actually prepare for the pandemic. There was a recent publication in Nature Microbiology that suggests that the current antivirals we have against flu A may not be great against the H5N1 that's currently circulating, let alone any new mutations that might come about. So this was a preclinical study, so animal study. They explored different infection routes like the eye or the nose or being ingested, so the stomach. And the bottom line was that our antivirals in general were not successful in treating severe H5N1. So we've got a lot more studying to do, but we probably also got some antiviral medication development to do. So hopefully we can take this for the warning sign that it is. We don't quite seem to be prepared. So hopefully the virus will not move faster than we do. But we have been aware of this issue for some time now. And certainly for the last year, since it showed up in our cows, we've been acutely aware of it. So we really are going to have to step up our efforts in this regard. And related, on March 17th, the United Nations Food and Agriculture Organization, FAO, delivered a briefing during which they highlighted the need to urgently address the current bird flu situation. They noted the need to strengthen our efforts in biosecurity, surveillance, monitoring, rapid response, risk communication. And being that this is the Food and Agriculture Organization, so this is not the health organization, this is food and agriculture, the focus of their comments was really regarding the poultry sector in particular. We know that the magnitude of this outbreak has jeopardized our food supply. It's jeopardized the supply of chickens and eggs. It's driven up prices. It's affected people's livelihoods, and particularly depending where you are, this could affect entire communities. And it's affecting the food supply here in the United States and to other countries as well. And remember, these are important sources of protein, and we already face food insecurity here in the United States and all over the world. So I am glad that there are entities out there concerning themselves with the need for coordinated global action around the spread of the virus, as well as around our global food system. So a lot to be concerned about here as a society. On an individual level, as I mentioned, the biggest risk is really going to be people working directly with cattle or poultry. We want to make sure that those individuals have good, up-to-date information, that they have sufficient personal protective equipment that they need to protect themselves, and that they're aware of whatever their industry standards or guidelines may be. And then for everyone else, let's avoid consuming raw milk and raw milk products. Please do not touch any wild birds or any dead animals. And also, you'll want to keep your pets from doing that if possible. And cook your meats thoroughly. And now I'm glad to share a bit of positive news, which is that March 15th has been recognized as Long COVID Awareness Day, both internationally and here in the state of California. And this was a result of quite a lot of advocacy by a number of different groups and organizations and leaders and patients and family members. Truly a collective effort that has resulted in this important recognition. And if you follow Roots or you've been watching the briefing, then you know that we often bring up awareness days and awareness months, as do many other health organizations. Awareness days bring about recognition and support. They can reduce stigma or just lack of understanding, and ultimately, hopefully, secure resources to help us address the burden. And in this case, we really do need that focus and attention and research and resources to address the burden of long COVID. And I want to say how significant I think this is in particular, because even though for those who are suffering, it can just feel like forever, it can take decades sometimes before conditions receive any recognition at all, or even an acknowledgement that they exist. So even though we know that the real work lies ahead in terms of research and finding treatments and gaining better understanding, I do think this is a very significant milestone, and everyone who advocated for it should be very proud of achieving it. And in honor of Long COVID Awareness Day, which was just this past Saturday, March 15th, I thought I would try to bring about a little bit of awareness regarding long COVID in children. I'm finding that we are still suffering from what I think was one of the biggest communications errors in the pandemic, which is saying a lot because there were quite a few. But that is this notion that children are not affected by COVID. The fact is that not only does COVID remain a leading cause of death in young people, we know that some percentage of children will end up with long COVID and post-COVID effects following an infection. It is still very difficult to estimate the magnitude of this, but with millions of infections occurring and continuing to occur, we need to get our arms around this. We really don't know still who is more at risk. It's not something we can predict. The only way we have to prevent it at this point is to prevent the COVID infection itself, which is difficult. And we have no approved treatments to this day. In truth, there's probably a lot more at this point that we do not know than things that we do know. But it does appear that each new infection is a new opportunity to develop long COVID or post-COVID impacts. And just because you had COVID before and did not develop long COVID does not give any guarantee whatsoever about what will happen with the next infection. And there does not appear to be any limit to the number of times a person can get COVID. And of course, when it comes to our children, they hopefully have a long life ahead of them. So that is more opportunities for more COVID infections. So it really behooves us to understand what we are dealing with and what we can do about it. And all of this is in the context of children being in schools with so much mixing going on all day long, and with still too many of our schools having inadequate ventilation and an inadequate or just really no way that spread is being mitigated at all. So still a lot of work to do in this regard. But in the meantime, I wanted to review this article that was published last month in JAMA Network Open. It is an original investigation called COVID-19 Vaccination and Odds of Post-COVID-19 Conditions, Symptoms in Children, age 5 to 17. And this is an observational study, so it's not an experiment, but this is where we're going to look back at what's already happened. Specifically, the design of this study is called a case control study. So what they do in a case control study is that they identify the cases. So in this instance, that would be children who have reported long COVID or post-COVID-19 condition. And then they identify the control. So that would be children who do not have long COVID. And they were specifically looking at children aged 5 to 17 who had a PCR-confirmed SARS-CoV-2 infection during the study period, which was July 27th, 2021 to September 1st, 2022, so about 13 months. Then they had them complete a long COVID survey at least 60 days after the infection. And then they had weekly COVID testing and continued surveying regarding their symptoms. And the goal here in this study was to compare the cases, so those with long COVID, and the controls, the ones without long COVID, and then identify whether or not they had the COVID-19 vaccine. So that's what they call the exposure. So that is what we are basically checking against the controls and the cases. And they verified vaccine status through vaccination cards or the registry or through medical records when they were available. So a total of 622 participants ended up being included in the study. 5% were cases, 95% were controls. This distribution actually mirrors fairly closely what we've seen in the literature so far about the percentage of people who get long COVID. Something really important that they do in these types of studies is that they adjust for the characteristics that they're seeing in the group that they're studying, and they try to control for them. So they basically adjust for those different characteristics. So they adjusted for demographic characteristics. They also adjusted for the number of symptoms that individuals had during the acute COVID infection, which I thought was smart. Then they also adjusted for their baseline health status. That's very important. So this is how they try to address the different variables that exist when you're doing an observational study. And what they found was that the mRNA vaccine was associated with reduced odds of long COVID in children. They looked at children who had one or more symptoms, and then they looked at children who had two or more symptoms of long COVID. So they analyzed those separately. But what they found was that the mRNA vaccine reduced the likelihood of having one or more symptoms by 57%, and they reduced the likelihood of having two or more symptoms by 73%. They also found a 72% lower likelihood of respiratory post-COVID symptoms in this age group of 5 to 17, as well as a 75% reduced likelihood of post-COVID symptoms that affected the day-to-day functioning of these children. So I think that's pretty significant. Of course, we know that the mRNA vaccine itself also reduces the risk of getting COVID in the first place. So that wasn't even part of this. So this is just a reduction of getting long COVID after a COVID infection. So, but we do also have to keep that in mind, because basically this suggests that we almost have a triple benefit of vaccination. So you reduce your risk of getting COVID in the first place. You reduce the risk of a severe outcome if you do get COVID. And this study indicates that you are also reducing your risk of long COVID as well. And we have seen very similar findings in adults. So this does help to bolster those conclusions as well. So a study like this is, of course, going to have limitations. Maybe the most significant one is that symptoms are self-reported, but that is why we have cases and controls, because that issue will exist in both groups. Also, 10% of study participants were lost to follow-up, and there's really no way to know if those people were more likely or less likely to have long COVID, so another limitation. But nonetheless, I do think this is a bit of hopeful news, and also it somewhat replicates what we've seen in adult studies as well. And it's really important information that as we think about the benefits of vaccinating children against SARS-CoV-2, we should be well informed and not go by some of the miscommunication or failed messaging from early in the pandemic, and realize that not only do we have the benefit in terms of protecting against severe illness, protecting against infection, but also it appears protecting against long COVID as well. Now, I want to be really clear that this is regarding getting vaccinated prior to infection. We know that for people with long COVID, who then get a vaccine, that this has very mixed results. It can result in improvement for some, it can result in no change for others, and it can result in worsening for others. Now, this was not looked at in this particular study, but we have seen that in adult studies, and I went over this in a prior briefing that was specific to looking at vaccination and long COVID in adults. I've linked that briefing in the post in case you are interested. So just a reminder about respiratory illness vaccine recommendations: COVID annually for everyone 6 months and up, and every 6 months for those 65 and up or those with moderate immune compromise. Flu annually for everyone 6 months and up. RSV for everyone 75 and up. This is a newer recommendation, and 60 to 74 with underlying conditions or in a nursing home. And pneumococcal vaccine is for under 5, and this is also an updated recommendation. It used to be 65 and up, now 50 and up for the pneumococcal vaccine. And let's remember to maintain our best practices to prevent the spread of respiratory illnesses. And let's stay informed. Let's do what we can to keep ourselves and our loved ones safe and healthy. Remember, if you don't have a primary care provider, please get one. Develop a relationship with them. Make sure you're getting the appropriate screenings and vaccinations based on your age and risk factors. And let's try to eat a balanced diet, quit smoking, limit alcohol intake, avoid sugars and processed foods and artificial ingredients. If you don't feel well, make sure you get your rest. Otherwise, please get some regular physical activity, get some fresh air, manage those stress levels, and get a good night's sleep. This concludes today's People's Health Briefing. Thank you so much for joining us, and we'll see you again next Tuesday at 10 a.m.